This is from the 60 Minutes Donald Trump interview that was cut short because Lesley Stahl was very unfair, I think, in how she talked about the pandemic. Now, there is basically a very simple attack going against Trump, and it's cases are up, cases are up. And that somehow is Trump's fault. And I'm going to prove to you it isn't by just simply reversing the issue. I'm going to let them talk for a minute and I'll explain what the issue is, and I'll even tell you up front. Basically, there has been no treatment protocol when patients are put in 14-day quarantine at home. Think about that. You have a disease that can kill you, and you're told sit in your house for 14 days under quarantine. Oh, and by the way, we have nothing for you to do to help fight it off, reduce the effects, help the body fight it off. We have nothing to offer you. And therefore, we'll never talk about that again. That's what they've done. And Stahl will do that tonight by saying cases are up, cases are up. And if you're a doctor out there and you've gone to the hospital and your patient's dying from COVID, do you remember the time when they first tested positive and you told them to stay home for 14 days and let COVID-19 dominate them because you had no treatment protocol to offer? Is that why you're so angry with Trump when you see your patients dying in the hospital? Because you remember when they were at home for 14 days letting COVID-19 grow inside them so it would kill them? Do you remember that time? Is that why you're blaming Trump? Because you didn't have the courage or the strength or the respect by the higher-ups in your medical community to do tests, to listen to you, that they weren't listening to you. Is that possible? Possibly what's going on here? And that's why these doctors are on Twitter now blaming Trump for higher cases, why Lesley Stahl is doing it as well?
COVID cases going up. I mean, it's like the gods have suddenly decided to conspire against you.
I don't think so at all, no.
It's not the gods, it's the media. Unless they see themselves as gods, it's the medical community. Again, I don't know how many times I got to say this. If anybody out there has ever seen a reporter ask a doctor, ask anybody, how come there are no treatment protocols when patients are first put in 14-day quarantine? Please send me the link. Because don't you think that question should have been asked at some point in the last 8 months, at least once?
Oh, no, I think
Well,
we've
what
done a
about
great
these-
job with COVID.
Sir, excuse me, cases are up in about...
Sir, excuse me? Really? Are you serious? Sir, excuse me? Do you see how one-sided she is? Her mind is completely medical-centric. She can't for a moment step back and question the medical community about anything. So I'll say it again. I'll ask it again. To those of you who had somebody die in the hospital from COVID-19, and you probably weren't even allowed to visit, right? But maybe that's why they keep them covered up, so that way their guilt is less. The medical community's guilt is less. What did they tell your loved one who's now dying when they first had the symptoms? Didn't they say home quarantine for 14 days, but we have nothing to give you? Isn't that what they did? Is that what you would do if you had a cut on your hand, on your wrist and it was bleeding? Would you want your doctor to say to you, well, come back in 14 days and we'll see if it's scabbed over or not, or if you bled out and died. We'll figure it out. Would that be acceptable? Or would you want to cover the bleeding right away? Would you want to try to have dominate the COVID-19 before it dominates you? Wouldn't that be, isn't that what Trump wanted all along?
are up in about 40
Okay.
states.
You know why cases are up also? Because we do more testing. The fake news media loves to say cases are up. The fact is we've done a very, very good job.
Cases are up.
We have done...
That's all, that's like her little parrot brain. Cases are up, cases are up, cases are up. That's all she can do is say cases are up. How about Lesley Stahl going eye to eye with the doctor, going into an ER and asking the patient's doctor, what did you do for this patient when they were first diagnosed with COVID-19? Besides say, stay home for 14 days so we can see if it's going to kill you or not. Why isn't that part of the discussion? That's what Trump has not trusted all along, and his instincts were completely right.
That's right, because we're doing so much testing.
There is increased testing, but according to the COVID tracking project,
So there is more testing, but
that doesn't account for all of the rise in new cases
well, whether there's new cases or not, you're not doing anything for the first 14 days. So the medical community hasn't done their job. And here's another thing. They're suppressing mask study. There's a study in Denmark on masks.
Out there saying we've turned the corner. This thing is disappearing,
That's
and
right, we
people
have turned
can
the corner.
see cases going up all over the
Cases
the
going up.
Midwest,
Cases going up.
in the Mountain West. Record numbers.
From
of
sea
cases.
to shining sea, they're going up.
We understand the disease. We understand the elderly, and we are taking care of them like nobody's ever taken care of them. So we are taking care of our people.
Okay, let me ask you something about suburban women.
Yeah.
Okay. So there it is. You just saw she had no game. She had no ability to take Trump's side for a moment and do any kind of research on Trump's behalf as to why there's been no home quarantine treatment protocol for when the people are in their 14-day home quarantine. That's the issue. So I was talking about the Denmark mask study. There's a mask study that's already completed as to how effective masks are, and it's being suppressed. It's not being released. It's not being peer-reviewed. It's an actual doctor study. Why? They're waiting till after the election so they can go, oopsie, you know, there might be another suppression besides the possibility of what we don't know about wearing masks all the time. The other issue is eye infections, because when they show that black and white video with the green smoke, kind of the green air going out, when people have a mask on, so you can see how much it cut down. The air was going up over the eyes, into the eyes, up above the head. And now there's a large increase in eye infections. And once again, the doctors are afraid to say anything. So you've got certain doctors going along with the higher ups. You got other doctors just keeping quiet because they know they can't say anything, or they may even lose their license. There's no investigation about that. So anyway, this was a waste. Trump knew it was going to be a waste, and he was right. They were just going to recover, go over existing issues, no new thought processes, no new angles, just cases are up, cases are up. That's it. That's all they got. And they won't acknowledge if masks are increasing that the cases going up, and they won't acknowledge that not having a treatment protocol when people are first put in 14-day home quarantine is causing issues. And I'll just say it one final time and I'll close. You doctors out there who told patients to go in a home quarantine for 14 days and then that patient ended up dying. Do you really think that was a smart move for 14 days to just let them sit and let COVID-19 dominate them? Was that really the right move when you think back on it? Don't you wonder why there wasn't even a protocol for a treatment protocol? Like, you know, if you want to, you can try this, this, and this, but we don't know if it's going to work. And here's one final thought. You have all these people in home quarantine, right? Why didn't you do a clinical trial where half of them wore masks all day and the other half didn't? And see who recovered better and quicker, or if there was any difference at all, just to know on a personal level. Because we keep talking about don't spread it to other people, so you'll be home quarantined. But what a perfect place to study the effects of masks, right? You got COVID-19, you got the symptoms, wear your mask for 14 days in half the group. The other half don't wear a mask, and then follow the results. That was never done. Now, how can you trust them? How can you submit and be dominated by a medical community that refuses to do the most obvious benevolent tests that would have harmonized the country together. Instead, by being so obtuse about what they should have been doing in the medical community, they instead divided the country and blamed Trump.